Thank you, Simone. If you, I make very, very quickly our experience. Okay, our ERN is one of the smallest, I think, ERN, but we have a lot of members and we cover a lot of country and hospital, but as you see, the number is not so big. So next slide, please. We have at the moment, we are very well involvement. This is the official slide with a different working group of EPICARE working group is the official one. I put in yellow where we are involved, and as you see, we are involved in most all activity. First of all, we are involved in the board with ePAG chair and deputy chair, and we have a monthly meeting. We are involved also in a very important group of research council, and we nominate 2 ePAGs for 2 years, and then we can change every 2 years the referent that represent in the strategic of research council the patient voice. We are also involved in ePAG management team. We have 2 members of the management coordinator of ERN that working with us to try to help us to disseminate information, to make a strategy, organize the meeting, send the email to all working group and the patient representative to be present in the meeting regularly, and we try to make a drive and all ePAG activity together. And it's very, very important the support that we have of 1 secretary, more or less, and the other one helping us also with dissemination and also the social activity. And okay, the different working group is very specific because we have the coordination meeting, we have the registry, for example, guideline, we have different projects, and in each of them there are 2 ePAGs. We have internal rules that 2 ePAGs that decide to follow in a working group need to necessary to be present regularly. If they are not available, they can send an email and we search a volunteer that can cover or be present in the meeting regularly to replace, sorry, the person that are not available. So our goal is to have minimum 2 ePAGs for every working group in the meeting. The meetings are every monthly or bi-monthly meeting, and we need also to follow in the project and disseminate if there are questions that involve the different ePAG in the different working group. And we have a new working group dedicated specific for the patient, the ePAG, the patient group, and also the strategic plan that we can have as EPICARE. So if you go in the next slide, please. I take an example. Okay, we are 50 ePAG at the moment involved and nominate patient representative, but we involve also the different association and network for also the big Bureau for Epilepsies in Europe, and we have a mailing list and more of 115 associations. Next slide. Okay, now is, as I tell you before, this year we create a new working group, is 19 working group dedicated to the ePAG. But the goal is, and we try to discuss internally with all ePAG, which are the goal for the next budget and the next plan for ERN is 23-27, 4 years plan. And our goal, we decide that we want to focus in 5 principal goals. One is patient journey and leaflet for rare and complex epilepsies. We done at the moment 15 patient journey and leaflet dedicated for the single disease, translating the different language, the process is ongoing. And we want to achieve most of the principal disease because we have more than 130 different epilepsies. We want to promoting the initiative with video because we do a lot of activity, but the patient doesn't know that and not all go to the website. So we want to create a new video to promoting, for example, emergency protocol, patient journey, what we are do available for the patient and the community. And we want to do everything in English, but we undertitle for the different language. So it's a big question about the translation. We want to propose a face-to-face meeting for the patient community together with International Congress for Epilepsy. Another big goal is a survey for patient community needs. It's very important because we have a lot of ultra-rare disease or very new disease. It's very important to know the community. And also support and stimulate the patient in participation in research project and dissemination. A lot of us are involved in the European Joint Project of Rare Disease, in publication. We do also, as ePAG, a publication with the impact of the diagnosis, the gene diagnosis for the patient. We do a lot of poster during the Congress and dissemination. This is something that we want to continue and implement for the next 4-year plan. And for this reason, we will ask to our coordinator to have some support budget for realize all of that, because we need also to collaborate with external parties, special for survey, for the publication in open access, have some cost, and for the video, for example. And as you know, the budget is, we need to present the budget until the end of this month. And also there are some criteria, and we will to present a project. As you see, it's a project for all patient community, but also address to the EPICARE initiative. And we hope we can have some funding for realize all of that. If you see next slide, is only a resume. What we are cover is, as I tell you, patient journey leaflet, video, face-to-face meeting is very important for the community. Also for involve more ePAG if possible in the EPICARE activity, and also the survey, I think could be very helpful for our community to know each other and to know some specific important items that is transversal for the different epilepsies. Okay, I think I will present our idea because it's very important as community to have clear which are our goals, and every group need to address that, and also how we can link to the budget is not easy, and also to the needs of also ERN general activity. Okay, thank you. This is my experience. We have short time, so I give to the next.